Medurstand. Understanding medicine.
Professor Aziz or Rehman from Medurstand. Today we are going to start the examination of a respiratory system. Let me demonstrate percussion of the lungs. Percussion of the lung is a very important, and you know, normally lungs are aerated, and when we percuss it, it exhibits a specific tone. We call it a resonant tone. So maybe I can start percussion from here. This part, which is above clavicle, this is actually part of lung. So typically we start from here like this. We start from above and come downward, and I think ideally you should be comparing both sides, like for example like this one, this, maybe then I can percuss on clavicle. We actually comparing both sides. This is normal tone. You must appreciate that this area, because of the heart, there would be some dullness. Then I would do the same on the side, like this one. Maybe I can complete on one side, like this, and then we go to the other side. So this is percussion. Please set up. Then we can do the percussion from the back, and very convenient. I think I do it this way. You can't put your finger in the intercostal space here because ribs are in a different direction, but just I think horizontally, like this. This is when we percuss the whole chest, but when we are specifically looking for pleural effusion, suppose we are looking for pleural effusion here. So what I will do is that I will start percussing from here and go downward. In the normal lung, there should be resonant percussion, and if there is pleural effusion or there is some mass or there is pleural thickness, that the percussion will become dull. Now in the percussion, you are really comparing one side with the other side. There are some anatomical differences, like for example, right diaphragm is at a slightly higher level because of the liver as compared to left. So must note that. And in the front, on the left side there is heart, and on the right side there is a liver. So I think otherwise both areas, both sides of the lung should have same type of resonance. Now we can have normal resonance, we can have dull percussion note, and dull percussion note is typically seen in pleural effusion and any solid mass, most likely pleural effusion, and also in pneumonia. And there may be hyper resonant tone if there is pneumothorax. Of course, we cannot make a definitive clinical diagnosis on the basis of one sign. Typically, we take all the signs, inspection, palpation, percussion, auscultation, and then we make a diagnosis. So this was about the percussion.